Nurses are the most trusted profession. We hear this every day, usually around Nurses Week. Currently, there are three vaccines approaching the final FDA approval process: Moderna, Pfizer, and AstraZeneca, Oxford. In light of an available and approved vaccine for COVID-19, how do we best deploy that trust? What if we are not so sure ourselves or feel as though we have been forced into a vaccine we do not think is necessary? Response to the pandemic has been a patchwork of state and local ordinances. Public health measures are viewed with some skepticism, and there are subpopulations that view the pandemic as a hoax designed to enable government control of citizens and refuse to comply with mask wearing or social distancing orders. This same dynamic may make it difficult for healthcare agencies to encourage vaccination. From the Boston Globe, November 28th, 2020. As drug makers close in on vaccines against the coronavirus, medical professionals and online disinformation researchers are warning that an expanding anti vaccine movement, bolstered by far right opponents of coronavirus lockdowns, could undermine efforts to get Americans to take the shots and end the pandemic. They are urging health authorities, hospitals, and pharmaceutical companies to invest heavily in public education to counter the misinformation and build confidence in the vaccines. Vaccines are one of our greatest healthcare achievements, said Dr. Bisola Ojikutu, an infectious disease specialist at Massachusetts General and Brigham and Women's Hospitals. The same energy that was placed into development and distribution of a coronavirus vaccine should have been placed in the messaging and community engagement. As the largest group of healthcare providers, nurses are trusted by patients, and so messaging and modeling from the nursing community will be critical to widespread vaccination, herd immunity, and a return to some kind of normalcy in the months ahead. But how do we deliberately consider the balance of rights and obligations? Accepting vaccinations involves ethical principles of beneficence, defined as kindness or charity that requires action on part of the emergency nurse. Non-maleficence, which is essentially the root of nursing, to do no intentional harm. And fidelity, keeping true to the profession promises and responsibilities. Vaccination distribution requires emergency nurses apply additional ethical principles of veracity, fidelity, and justice. Nurses promote the good by reducing community spread, reduce harm through vaccination, and keep their disciplinary promise to keep patients safe. In recommending and distributing vaccines, nurses give patients accurate, science based information, reduce risk to individuals and communities, and advocate and provide for access to all patient groups. Additionally, the ANA and ENA have a code of ethics that specifies relevant ethical provisions. Among them is Provision 5, Duty to Self, which states the nurse owes the same duties to self as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. The provision that requires the promotion of safety and promotion of health directs the nurse to reduce harm to self and others through safe and effective preventative measures, such as vaccination. It also requires nurses to demand safety through appropriate PPE and other infection control measures, and to resist overwork and fatigue that can impair decision making and care. Provision 6 of the ANA and ENA Code of Ethics further states the nurse, through individual and collective effort, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. This provision requires that both nurses and nursing leadership ensure access to that which reduces harm and promotes the good, All nurses should have access to safe and effective vaccinations, as well as PPE and other methods of infection control. The profession of nursing, and specifically the Emergency Nurses Association, must call for wide access to safe and effective vaccination processes for all populations and provide accurate, science-based explanations and advocacy supported by the Code of Ethics provision on social justice and health policy. The profession of nursing, collectively through its professional organizations, must articulate nursing values, maintain the integrity of the professions, and integrate principles of social justice into nursing and health policy. The ENA position statement on immunizations reflects these principles and states that emergency nurses have an ethical obligation to provide a safe environment for their vulnerable patients. This includes being up to date with immunizations. Modeling good behavior is essential. A pervasive sentiment right now seems to focus on distrust of the government and pharmaceutical companies. This sentiment results from a flood of misinformation. The federal response to the pandemic has been underwhelming, and the process by which information is disseminated has been potentially politicized. And lots of people are dead, and healthcare workers, including nurses, are exhausted. On the other hand, we are dealing with a novel coronavirus, meaning it is new, and a lot of information has evolved. Consequently, recommendations have changed rapidly. This is the scientific process playing out in real time, which not many people are used to. It does not necessarily mean that officials are unsure. It means that new information is being acquired at a very rapid rate. The vaccine development process, however, is well established, and the FDA and CDC have one chance to get this right. So it is highly unlikely that any corners will be cut in the evaluation and approval process. So, what should nurse leaders do in terms of encouraging emergency nurses to get vaccinated? From the available data, vaccination for COVID-19 appears safe and effective. It does not use attenuated virus or live virus, so there is no risk of becoming sick from the vaccine. Vaccinating healthcare workers protects them, their families, and their patients. It is expected that healthcare workers will be among the first to access the vaccine. Ethically, if healthcare workers are able to protect the more vulnerable at minimal risk to themselves, they should follow the principles of beneficence and non-maleficence. And so ENA strongly encourages all emergency nurses to be vaccinated as soon as one is available. Likewise, emergency nurses should encourage others, including their patients, to get vaccinated. As one of the most trusted professions, it is our ethical duty to get vaccinated and encourage others to do the same. It is essential that emergency nurses communicate to their patients that the vaccine appears safe, will protect them and their families from illness, and that patients should arrange with their primary care practitioners for vaccination at their earliest opportunity.